Hello, this is Dr. Gay from First Look MRI, and this is a 45-year-old female with complaints of knee pain for several weeks. She saw the orthopedic surgeon and they wanted to get an MRI to make sure she did not have a meniscus tear or some other finding to explain the pain. Her pain was on the medial side, and this is a coronal fat-suppressed protein density sequence. And on this view here, we see something along the medial knee joint. This is the lateral side over here. We see the little black wedge, the lateral meniscus. Everything looks good over here, but on the medial side, there's something abnormal, which is right here. This vertical band of brightness is a fluid collection, and it's over the capsular surface, the outside of the medial meniscus. The meniscus looks pristine. Here's the back of the meniscus, medial meniscus. This is called the meniscus body here. Here's the front, which we call the anterior horn, so that looks good. And the medial collateral ligament, the MCL, comes off the femur here. This is the big thigh bone, the femur. The medial collateral ligament comes down here and attaches to the tibia down below. And the MCL has two components. It has an outer thick component here. It has a thinner inner component. And the thinner inner component is adherent to the medial meniscus here. So the inner thinner component here, the capsular fibers, are intact. And the outer fibers here, the thick outer fibers, are intact. So this is a little fluid collection insinuating between these outer and inner fibers. And this is a potential space of bursa. It's called the medial collateral ligament bursa, or the MCL bursa, and this patient has bursitis, Mcl bursitis. So this bursa is inflamed, a little bit of fluid is in there, and it separates these two components. So a case of mild Mcl bursitis. This is an axial view. We can see that fluid collection here along the medial joint line. It'd be hard to tell what it is here. You'd think it was a meniscus cyst, but again, we can see on the coronal images that it is Mcl bursitis. Just incidentally, you may note up here this is a benign bone lesion in the femur, and this is probably a non-ossifying fibroma, which is partially healed. It's just a benign bone tumor. A lot of people have these when they're young, in the pediatric age, and then or adolescence, and then over time they involute and become sclerotic and dark like this, and sometimes they go away completely, but sometimes you're left with a residual patchy area of darkness. So this is just an incidental benign residual sclerosis related to an old non-ossifying fibroma, just incidentally here. And one more view. This is that MCL bursal effusion, Mcl bursitis, and this is that old bone lesion here that's gone on to heal. And that's it. Thank you very much.